Okay, this following segment is sponsored by myVax. With the COVID-19 vaccines becoming available, being in control of your vaccination, medical, and health history is more important than ever. myVax is a single system platform that puts you in control of your vaccinations, your medical records, and your health history. And it also allows you to own and control your data. I spoke to St. Louis Mayor Lyda Krewson, who explains why it's important for local communities to partner with a company like myVax. Madam Mayor, thank you so much for joining us today on Great Day Washington to talk about what we're all focused on right now. These COVID-19 vaccinations are being distributed at all cities. I was wondering, how is St. Louis doing? How are you guys doing, especially as you are preparing for your own vaccine distribution?
Well, thank you, Ellen. I really appreciate the opportunity to be on and talk with you today. And of course, like every city and every state across the country, we are preparing for the vaccine distribution. We have had a little bit of vaccine delivered here in our region, but of course, we are very anxious to receive more so that more people can be vaccinated, because clearly the effectiveness is not having a vaccine, the effectiveness is getting the vaccination. And we're using a tiered approach, just like most folks across the country, of frontline healthcare workers first, of course, first responders, people that are in direct contact day to day.
When it comes to administering this vaccine to the general public, what are some of the biggest concerns as you go away from, okay, first responders, we've got them, but as you go down, how are you going to do that?
Well, we are all anxious, of course, to be able to get this to the broader population. And then, as you know, the two vaccines that have been approved under emergency conditions now require two shots, two vaccines.
Right.
So, it is a matter of having the individual get the first vaccine and then 3 or 4 weeks later come back, get the second vaccine. So our federally qualified health centers are looking very seriously and beginning to implement something called myVax, which is a program where it would text you or get back in touch with you to remind you of your appointment. And also be able to, if you go to one federally qualified health center to get the first vaccination, you could go to another related FQHC to get the second. So, this is a big communication challenge, I think, for our country. And it would be good to have a platform, or maybe multiple platforms even, that could help people keep track, because ultimately we are each responsible for keeping track of our own medical health care. I mean, it's not like it was in the old days where you had one doctor and that doctor kept track of everything for you.
Right.
Today, we have to keep track of it ourselves. And even I will say something, oh, did I get that? Not meaning the vaccine here, but have I had that shot, or have I done this? And so it'd be good to have a system where a regional system, national system, where we were all helping to keep track of that.
Yeah, those reminders never hurt in our busy life right now. If you would have a message to other leaders who are trying to figure this out for themselves, how to go about it, what would you say of how they can implement this, myVax, in their own regions?
Well, I think that anyone can implement myVax or a similar product. But I think it's really important to step back from being a medical professional, perhaps step back and think about, what about that person who's not a medical professional, who doesn't understand all this? How do they keep track of it? And can you provide a tool for them to help remind them, to make sure that the medical technology that we have, which now is this vaccine, to make sure that it's as effective as possible by making sure people get the second vaccine, and they know which vaccine they got, because if you got Moderna the first time, you're supposed to get Moderna the second time, or if you got Pfizer the first time, you're supposed to get it the second time. And as we get more vaccines, that's going to become even more challenging.
Right. And I'm sure that cities right now, they're looking to make this partnership. Sense of urgency, I assume, is important right now. Why would this be the time when, okay, let's go find someone like myVax?
Well, everything's urgent right now. I think more than ever, the fact that it's only been a week and a day, or a week and 2 days since we had any vaccine, And now, what's coming into my inbox is, when can I get my vaccine? So you get it the next day. People want to know, and the communication, I will say, the media has done a terrific job of helping to communicate this, but there are still many people that mainstream media doesn't reach and social media doesn't reach. And so it's really a big and urgent communication challenge.
If there was something that you could tell other people of, like, all right, this is how we did it, where should people go?
If you're interested in following up on the myVax, go to myvax.com. I think you've got health leaders in every city and every county across this country. That's thousands of folks that are trying to figure this out. So this is one good option to explore, to help your constituents keep track of which vaccine they got, when their next vaccination is. Just go to myvax.com.
Absolutely. Well, thank you for taking some time today with us here in Washington, D.C. to explain it, and best of luck to you as well.
Thank you. Really appreciate it. Thanks to all. Have a good holiday.
And you can go to myvax.com for more information, or download myVax in your app store. There they'll encourage everyone, before you vax, get myVax.